ODYSSEY is a prospective observational study, and we enrolled about 468 patients in the U.S. We looked at their quality of life over time using PROs, patient-reported outcomes, and that was actually the primary endpoint. So what we looked at for this analysis was, of those 468 patients, how many were treated with IO-based combinations, so comparable to the current standard of care. And there were 268 patients who were treated with IO-based combinations. And basically what we were interested in looking at specifically in this regimen was early deterioration in quality of life. As you know, that has been correlated, both at baseline and early change has been correlated with survival. So that's what we started to look at in this analysis. We saw some interesting patterns, and I should probably just mention the specifics bear some explanation. So this was a non-randomized study, meaning that we enrolled patients who were untreated who had metastatic RCC, regardless of their histology. Patients and physicians chose their treatment, so there was no randomization here. And we did see some difference in baseline characteristics according to patients who got IO-IO, or in other words, ipilimumab-nivolumab, or IO-TKI regimens. So for example, the rates of nephrectomy were different, the rates of clear cell histology were different. There are some other differences like in IMDC risk factors. But we did see some variation. So for example, just to give you some specific numbers, there were about 142 patients who were treated with IO-IO, so ipi-nivo again, and there were 125 who were treated with IO-TKI. And within the IO-TKI group, there were differences in baseline characteristics and differences in early change in quality of life, with some regimens appearing to have better quality of life, early changes, and some appear to have no change or decrement. And now those are small numbers, so just to give you some specifics, the groups were about 35 for the nivolumab plus cabozantinib, about 40 for the lenvatinib and pembrolizumab, and 50 for axitinib and pembrolizumab. So small numbers, so I don't want to make too much of it, and we are powered to look at IO and IO-TKI, but we did see some, I think, important differences, and specifically that heterogeneity within the IO-TKI group was interesting.